Assalamu alaikum. Our lecture today is infertility. Infertility is defined as the failure to conceive within 1 year of unprotected regular sexual intercourse. It's primary for couples who had no previous conception and secondary for couples who had a previous conception and have then not conceived again. Epidemiology. A healthy couple having frequent intercourse have about an 18 to 20% chance of conceiving in the single menstrual cycle. 85% of couples will conceive within 1 year. 90% will conceive within 24 months, يعني within 2 years. 10 to 15% of the couples will experience infertility. Most will conceive after receiving advice and simple treatment, while only 4% will remain involuntarily childless. The most important factor affecting fertility is the female age, which is related to a decline in the quality and the quantity of eggs. Female fertility tends to fall sharply over the age of 36 with a further dip after the age of 40. Male age is also an important factor. Semen quality tends to fall in men over the age of 50. Frequency of intercourse tends to fall in men over the age of 40. Eggs are thought to be fertilized for about 12 to 24 hours post-ovulation. يعني life span of the eggs is about 12 to 24 hours after ovulation, while sperms can survive in the female reproductive tract for up to 72 hours, and some research say up to 7 days. Ovulation usually occurs about 14 days prior to menstruation, with the luteal phase being relatively stable at this length. يعني عادة المنسترول cycle اللوتيال phase يكون بيها ثابت اللي هو 14 days. اللي متغير عندنا هو الاوفيليتري. فthose who have short cycles usually يكون عندهم الشورت هو الاوفيليتري phase وليس اللوتيال phase. Fertile window for women will therefore be different depending on the average length of their menstrual cycle. For the woman with a 28-day menstrual cycle, her optimal fertile window will be between 12 and 15 days of menstrual cycle. Several general factors may adversely affect the natural conception rate. They are age قلنا. A natural conception declines significantly in the female after 35 years of age. This is due to decline in the oocyte quality and the quantity. Smoking reduces fertility in females and semen quality in male. Coital frequency, stress and anxiety may affect the libido and coital frequency and thus impact on infertility. Recommended coital frequency is 2 to 3 times per week. Alcohol, excessive alcohol is harmful to the fetus and can also affect the sperm quality. Body weight, over or underweight can affect ovulation. Women with body mass index of more than 29 or less than 19 will have difficulty in conceiving. Drugs, such as non-steroidal anti-inflammatory drugs, it might inhibit ovulation. Chemotherapy can destroy the rapidly dividing cell, example the gametes. Cimetidine, sulfasalazine, androgen injection also may affect the sperm quality. And 7 occupational hazards, such as exposure to chemicals and radiation, which is adversely affecting male and female fertility. The etiological cause of fertility could be female or could be male factors. Female factors include ovulatory disorder, tubal factor, endometriosis. Male factors and could be unexplained infertility. Ovulatory disorder. We divided into group 1 ovulation disorder. This is according to the WHO. Group 1 ovulation disorder. It represents 10% from the ovulatory disorder caused by hypothalamic pituitary dysfunction or failure, which is result in hypoestrogenic amenorrhea. It could be hypothalamic amenorrhea, could be a hypogonadotrophic hypogonadism, or could be hypopituitarism. Group 2, ovulation disorder, which is about 85% from all ovulatory disorder, are defined as a dysfunction of the hypothalamic pituitary ovarian axis. This group of disorders result in an ovulatory oligomenorrhea predominantly involving women with polycystic ovaries, which are present in about 80 to 90% of women with oligomenorrhea and 30% of women with amenorrhea. The PCOS is a heterogeneous collection of signs and symptoms with the cardinal features of hyperandrogenism and polycystic ovarian morphology. The criteria for the diagnosis of PCOS are: first, oligo or amenorrhea, F1 oligo or anovulation, we have the same, oligo or amenorrhea, clinical or biochemical hyperandrogenism, polycystic ovaries more or equal to 12 follicles measuring 2 to 9 millimeter in diameter and increased ovarian stromal volume more than 10 cubic centimeters. This is called the Rotterdam criteria for the diagnosis of polycystic ovarian disease. Women with PCOS may present with anovulatory infertility, menstrual irregularities, oligomenorrhea or amenorrhea, hirsutism, and obesity. Other factors include congenital adrenal hyperplasia, androgen secreting ovarian tumor, and adrenal tumors. Group 3 ovulation disorder account about 5% from the all ovulatory disorder caused by ovarian failure or ovarian insufficiency, as it is called now. Premature ovarian failure, which is occur below the age of 40 years and characterized by amenorrhea, high FSH, and low estradiol. This could be genetic, as Turner's syndrome, and gonadal dysgenesis, acquired as in viral infection or exposure to toxins, iatrogenic as in radiation or cytotoxic therapy, and an autoimmune disorders. In this condition, why there is a high FSH؟ لأنه الريجوليتري افكت مالت الاستروجين هيختفي يروح، الاوفري ما يستجيب للاف اس اتش، فالنيجاتيف فيدباك ميكانيزم تختفي، فحيظل يصعد الاف اس اتش عالي، فذول عادة يكونون امنوريك هايبو استروجينيك بس وياها يكونون هاي اف اس اتش، يعني هايبر جونادوتروفيك هايبوجوناديزم. In this case حيصيرون هايبر جونادوتروفيك هايبوجوناديزم. Hyperprolactinemia, increased prolactin production interfere with normal pulsatile GnRH release and leads to anovulation, amenorrhea, and galactorrhea. Example, prolactin-producing pituitary adenoma, craniopharyngioma, chronic renal failure, primary hypothyroidism, and drugs such as methyldopa, metoclopramide, cimetidine, reserpine, وفينوثيازين. هاي أمثلة على ال causes of hyperprolactinemia. This is an examples for causes of hyperprolactinemia. Tubal factor infertility. Infection. Pelvic inflammatory disease is a principal cause of a tubal factor infertility, which may be due to sexually transmitted disease or as a complication of miscarriage or puerperal infection or pelvic surgery. Surgery, gynecological surgery, urogynecological surgery, and appendectomy or previous tubal ligation. Other causes, using of intrauterine contraceptive device or distorted tubes by corneal fibroid, polyps, or endometriosis. So, major cause for tubal factor is infection, then could be due to surgery or could be due to other factors such as the using of intrauterine contraceptive device or fibroid that pushing the ostium of the tubes and others. This is an examples of closed tubes. This is an hysterosalpingogram. We will take it later on. الأشعة الملونة معروفة باللي words عندنا. Here you see that there is no spillage of dye. There is an adhesion around the distal end of the left tube with dilatation of the distal end of the right tube and dilatation of the left tube, distal end of the left tube, and also there is an adhesion. Endometriosis may lead to infertility through distortion of the normal pelvic anatomy, interferes with ovulation, or may lead to low coital frequency due to dyspareunia. انتوا اخذتوا الاندومتريوسيس اعتقد بالفصل الاول وعندكم معلومات كافيه عن الموضوع. This is a picture of endometriosis. This is a peritoneal surface of endometriotic spots. This is an endometriosis on the ovarian surface with adhesion. End of the tube, adhesion around the ovary. This is the ovary. This is an endometrial spots, and this is the tubes adhere to the ovary. Male factor infertility. Disorders of spermatogenesis and impaired sperm transport. It is either بالspermatogenesis المشكلة أو بالtransport of the sperms. Azoospermia may be classified into obstructive, which could be congenital, absence of vas deferens in association with cystic fibrosis, congenital malformation of the epididymis, ductal obstruction, testicular surgery, and vasectomy, or could be non-obstructive. So, the obstructive cause of azoospermia could be congenital or could be acquired. مثال على الcongenital هو absence of the vas deferens اللي يكون associated with cystic fibrosis or congenital malformation of the epididymis. So, could be acquired as in case of testicular surgery or vasectomy. A non-obstructive cause as in Klinefelter syndrome and in microdeletion of the Y chromosome. Oligospermia may result from hormonal problem or could be due to retrograde ejaculation, could be to varicocele or rise in scrotal temperature as in hot baths and descendant testes or in tight underwear. Ejaculatory dysfunction could be happened in case of diabetes or in prostatic surgery as a complication of a prostatic surgery. Environmental and occupational factors such as using of certain medication we have been mentioned earlier, such as cimetidine and others. Smoking, alcoholism, as we mentioned, might affecting the semen fluid quality. Toxin, insecticides, truck drivers because they are sitting for a long period, hot weather. Infection such as mumps or orchitis or sexually transmitted disease such as chlamydia might cause obstruction or might cause destruction to the testes. Immunological factor as in case of anti-sperm antibodies. Unexplained infertility, this is diagnosed when routine investigation including seminal fluid analysis, tubal patency, evaluation and test for ovulation yield normal result. Both male and female do a total investigation and there is nothing here will be occur in a category of unexplained infertility. Diagnosis, history and examination. A detailed history should be taken from both partners. This should include a question about the duration and type of infertility, whether it's primary or secondary, previous infertility treatment and outcome, general health and lifestyle, specific question about the sexual history and coital frequency, timing of coitus and mid-cycle, history of sexually transmitted infection and the treatment, early morning erection and the frequency of shaving for the male together with the rest of the confidential history. It will give a clue about the testosterone level. Both partners should be examined as shown in this following table. Physical examination. We have a general examination and we have a local examination. For the general examination in female, we look to the height, weight, body mass index, blood pressure, fat and hair distribution, acne, galactorrhea. For the male, we look also for the height, weight, body mass index, blood pressure, hair distribution, gynecomastia. Local examination in female, we are looking for the abdominal examination for any scars, striae, abdominal masses, pelvis inspection of the external genitalia, speculum examination for the vaginal if there is any vaginal septum or infection, cervical ectropions, polyps, suspicious lesion, accessibility of the cervix for inseminization. أنا مخططة أسوي للمريضة intrauterine inseminization. I should look to the cervix, to the opening. It is adequate. It's okay. حتى أقدر أشوف successful multi in case of inseminization or in case of IVF, in vitro fertilization. Bimanual palpation of the uterus, size, shape, position, mobility, tenderness, adnexal mass, all these should be checked in female. In male, we check for groin for the hernia, genitalia, the presence, volume, location, and consistency of the testis, epididymis, vas differentiae, varicocele, penis for any structural abnormalities or hypospadias. كل هاي should be examined carefully. في بعض الأحيان نلقى إنه المتخصص بالفرتيليتي كان examine both الميل والفيميل، وفي بعض الأحيان لا نحتاج إنه ندز الميل إلى متخصص بالinfertility والفيميل تنشاف من قبل ناس متخصصين بالinfertility. Could be by one person or by a team. Investigation. When to investigate? In the absence of any non-reproductive pathology, couples who have been trying for 1 or 2 years should be investigated and treated in a dedicated fertility clinic. فإذا هي 1 to 2 years. Earlier intervention is indicated in the presence of a specific high risk factor in either partner. مثلا المريضة عمرها 35 سنة وفوق، هاي تحتاج تنشاف earlier، بينما اللي تجيني متزوجة عمرها 16 سنة 15 سنة لا، هاي ممكن بيها. فإذا according to the risk factor. In the male, this could be a history of azoospermia, testicular surgery, vasectomy, or coital failure. مثال يعني الميل لما يجي عنده واحدة منها الهيستوري هذا يتطلب إنه أنا أتدخل مبكرا. Reasons for early referral in a woman include oligomenorrhea, older age, endocrine condition affecting ovulation, history of tubal disease, endometriosis, or salpingectomy. Parameters of seminal fluid analysis. This is a WHO criteria in 2010. Sperm volume 1.5. This is the lower reference. أنا قاعد أنطي هسه هنا lower reference اللي بعدها يعتبر abnormal. فالlower reference للseminal volume هو 1.5. بالنسبة للsperm concentration 15 مليون، جوا 15 مليون يعتبر abnormal. تحت 15 يعتبر abnormal. total sperm number 39 مليون، جوا 39 مليون يعتبر abnormal. Progressive motility 32%، جوا 32 abnormal. Total motility 40%. Vitality 58%. Sperm morphology 4%. pH equal or more than 7.2. Leukocyte should be less than 1. And the immunovid test less than 50. هذه الاجلوتينيشن اللي هي هاي الاميون ستاديز خاصة للسيمينال فلويد اناليسيس. This is the morphology. المورفولوجي جدا مهم. This is here the normal one. Here هنا abnormal. الabnormality ممكن تكون any part of the sperms, could be in the head, could be in the neck, could be in the tail, anywhere. This is under electron microscope. This is under electron microscope. Further investigation for the male will be according to the finding from the history and from the examination of the seminal fluid and include endocrine test as FSH to differentiate between obstructive and non-obstructive. يعني احنا بالبداية لازم ناخذ الهيستوري والإكزامينيشن، بعدين ندزه for seminal fluid analysis. According to these finding اللي تطلع لنا منها الشغلات حنقرر ندزه بعد further investigation أو ما ندز. Normal level will indicate obstructive causes where surgical sperm retrieval may be considered, while elevated level of hormones may suggest a failure of spermatogenesis. يعني إذا إجاني السيمينال فلويد أناليسيس أزوسبرميا ماكو سبيرمز وشو دزيتهم على هرمونال وطلع ال FSH وال LH نورمال، إذا هذا الأكثر هو obstructive cause، وبهيج حالة أنا أقدر أسحب السبيرمز عن طريق العملية الجراحية، ياخذون سبيسيمن من التستس مباشرة. بس إذا دزيت FSH و LH ولقيتهم very high، هذا most probably hypergonadotrophic hypogonadism، يعني failure، يعني gonadal failure، يعني مشكلة بالسبرماتوجينيسيس، وهذا الموست difficult. في حال احتمال يحتاج sperm donation. other causes اللي احنا او other investigation اللي ندزها بعد الاندوكراين وبعد السيمينال فلويد اناليسيس، ممكن ندز على chromosomal and genetic studies، ممكن ندز على microbiological study للسيمينال فلويد، ممكن ندز على imaging of the male genital tract دوبر varicocele، testicular biopsy قد نحتاج، وقد نحتاج نسوي الانتي سبيرم انتي بودي. اذا هاي الانفستيجيشن اللي حنسويها احنا بالنسبه للميل seminal fluid analysis، endocrine analysis for FSH, LH, TSH, the others hormone, maybe adrenal hormone, and then we proceed for these others investigation. For female, first of all we should assist the ovulation. A normal menstrual cycle is suggestive of ovulation. Confirmation of ovulation is usually obtained by means of mid-luteal serum progesterone level 7 days before the onset of menstruation. I mean day 21 of 28 cycle. راح ندز المريضة تسوينا بروجستيرون ليفل 7 أيام قبل الموعد المقرر أو المفترض لموعد دورتها الشهرية، أو يوم 21 من الدورة الشهرية. حنشوف اللوتيال البروجستيرون باللوتيال فيس، إذا شفناه عند ليفل معين معناه هذا الأوفيوليشن صاير، إذا أقل معناه هذه an ovulatory cycle. follicular phase هاي أول وحدة، أول طريقة إنه إحنا ندز progesterone level at day 21 of menstrual cycle of 28 day menstrual cycle length. Second, we send for follicular phase day 2 or 5 of the menstrual cycle FSH and LH. إذن إحنا نطلب FSH و LH أما في day 2 or to day 5 من المنسترول cycle. Thyroid function test, prolactin, androgen can be analyzed for those with irregular cycle. Transvaginal ultrasound is used for the assessment of pelvic organ and follicular tracking. يعني أنا أريد أشوف هاي الفوليكلز مالتها قاعد تكبر لو لا، فأنا بهيج حالة إيش أقدر أسوي؟ أسوي لها متابعة للمريضة عن طريق استعمال الترانسفاجينال ultrasound. من أسوي الترانسفاجينال ultrasound راح أشوف البيضة مال المريض قاعد تكبر لو لا. Assessment of tubal patency. Once a preliminary investigation suggests that the woman is ovulating، أنا أول شيء تأكدت أن المريضة ovulating تمام. إذن والsemen parameters جيدة بالنسبة للميل، إذن the next step should be assessment of the tubal status. This could be done by first ultrasound scan at what we called HICOSI. HICOSI هذا اختصار للهيسترو كونتراست سالفنجيوغرافي. HICOSI هو اختصار للهيسترو contrast salpingography salpingosonography involve the use of contrast medium saline or ecovis, which is installed into the uterine cavity through the cervix. The patency of the tube is confirmed by visualization the flow of the contrast along the tubes and into the endometrial cavity under ultrasound scan. Easily could be done بالدي كلينيك، والبين بيها يعني patient can تتحمل للبين. It is a simple procedure. Hysterosalpingiograph is done during the follicular phase, day 7, 8, or 9 of menstrual cycle, to avoid the risk of inducing an ectopic pregnancy or exposing an early embryo to ionizing radiation. Involve installing radio-oblique dye through the cervix into the uterine cavity. الصورة اللي شوفتكم إياها لما كنا نحكي على التيوبال فاكتور هي هاي الهيستروسالبنجيوغرام. X-ray image obtained show the uterine cavity and the outline of the fallopian tubes and the flow of the dye in the abdominal cavity, which confirm the tubal patency. If there is no spills, it indicates the tubal obstruction, or if the spills appears to be located, then there may be a peritubal adhesion. المريضة تجي يوم 7 8 9 من السايكل، طبعا لازم نتأكد انه ما عندها sexual intercourse خلال هاي الايام. يلا نقدر نسوي offering this type of investigation. ليش؟ لأن إذا صاير intercourse احتمال أكو صاير عندنا ovulation، واحتمال أكو عندنا fertilized ovum، وأنا من أجي أدفع الداي راح أني هذا الأوفم حسوي أحشره بالتيوب، حسوي لي ectopic pregnancy، أو ممكن صاير pregnancy ويجي يقعد بمكانه ويصير intrauterine، بس أنا حعرض الإمبريو إلى ionizing radiation. لهذا لازم تكون بالفوليكولار فيس، ولازم إنه نشور إنه ما عندنا كويتس قبل موعد إجراء الهيستروسالبنجيوغرام. ندفع داي عن طريق السيرفكس وناخذ سيريال اكس راي، وعلى السيريال اكس راي راح نشوف انه حيصير spilling of dye or there is no spilling of dye، واذا صار spilling هل هو localized لو لا ينتشر بالابدومين. اذا ظل localized احتمال هذا peritubal adhesion. This is an example for hysterosalpingogram. This picture show distal obstruction of both tubes. Picture on the left, distal obstruction of both tubes with hydrosalpinx. This is a dilatation, hydrosalpinx. Here on the right, this is showing this picture shows an didelphus uterus. It is a congenital abnormality. أعطاكم إياها دكتور عمر المحاضرة الأولى بالفصل الثاني. This is a congenital malformation of the Mullerian duct, didelphus. This is other picture here. Here in this on the left, it's a proximal obstruction in the right tube. A distal tube, there's a distal obstruction. Here proximal, or here distal obstruction. In this picture on the right, both of them obstructed distal proximally. From the proximal end of the tube, there is a block. Laparoscope and perturbation is the investigation of choice, as it's able to demonstrate the tubal patency as well as assess the pelvis for the endometriosis and adhesion. يعني احنا نستخدم اللابروسكوب to direct visualize the pelvic, and if there is any adhesion or there is any spots of endometriosis, and by the way we can show the tubal patency. هنشوف direct visualization للبلفس، فراح نباوع تماما السطح مالت اليوترس، الاوفري، البريتونيال، البلفيك بريتونيوم، كلنا نشوف اذا اكو اني سبوتس اوف اندومتريوسس، وبنفس الوقت ندفع مثلين بلو عن طريق السيرفكس، واحنا قاعد نباوع عن طريق اللابروسكوب ونشوف السبلج مالته بعيننا. فاحنا بهيك حاله حنتاكد وحنشوف السبلج ونتاكد انه اكو patency or not. هذه هنا laparoscopic view. This is the uterus, this is the left ovary, and this is the right ovary. Here we have endometriosis with adhesion in the pouch of Douglas. This picture on the right. Sometimes we can offer at the same time therapeutic، يعني يكون اللابروسكوبيك diagnostic and therapeutic. We can remove the spots of endometriosis. إذا كان عندنا filmy adhesion around the tubes, we can also do adhesolysis. So laparoscope at the same time could be a diagnostic and therapeutic. This is another picture of laparoscopic view. Here on the left picture we see a dense adhesion between the tubes, ovary and the uterus. On the right side it is a filmy adhesion. This can be easily free by using adhesolysis, by using a laparoscopic technique. Hysteroscope, uterine pathology such as adhesion, polyps, and submucosal fibroid has been found in 10 to 15% of women seeking fertility treatment. Hysteroscope has a beneficial diagnostic and therapeutic role for management of such pathologies. أيضا مثل اللابروسكوب بالنسبة للهيستروسكوب could be used at the same time for diagnostic and could be used for therapeutic. أعتقد حتاخذون معي معلومات أو أخذته بالoperative gynecology. We have two type of hysteroscope. We have the rigid hysteroscope and we have the flexible hysteroscope. هنا direct visualization for the endometrial cavity, and we can see to diagnose and take a biopsy for diagnosis, and we can do an immediate action to manage. Polyp, remove the polyp. If we have fibroid, remove the fibroid. If you have an Asherman syndrome, adhesion, intrauterine synechia, أيضا we can do visualizes. This is a hysteroscopic view of both osteae, right and left osteae of the tube. This is picture of submucosal fibroid through a hysteroscopic view. This is a hysteroscopic view, uterine synechia, intrauterine adhesion, Asherman syndrome. It looks like this by hysteroscope. Postcoital test. The postcoital test has limited prognostic value and is rarely used today. It involves assessment of the peri-ovulatory cervical mucus and the sperm in a sample obtained from the female partner 6 to 10 hours after coitus. Screening for sexually transmitted infection, rubella titer screen may be considered for women during investigation for infertility. Now we come to treatment of the infertile couple. Fertility unit. Treating couple with infertility should be individualized the treatment to each couple's chance of success. Counseling is an essential part of infertility management and may be beneficial to both men and women. All couples trying for pregnancy will benefit from some general advice such as cessation of smoking and alcohol intake. Pre-treatment counseling should include advice about general lifestyle measures, including the need to achieve an optimal body mass index. This involves weight loss in women with body mass index more than 30, but may require some women with weight-related amenorrhea and anovulation to gain weight. Preconceptional dietary supplementation of folic acid has shown to reduce the risk of neural tubal defect, and a daily dose of 0.4 mg or 400 microgram is recommended in all women. The investigations of couples with infertility will result in a number of diagnostic categories, each with its own management pathway. If we have a problem in the ovulation, so we come to treatment of ovulatory disorder. Ovulatory disorder should be managed by addressing the underlying cause first. قسمناها احنا وهسه accordingly. In a woman with weight loss related amenorrhea, treatment should be deferred until a target body mass index of 20 kg per meter square is reached, while those experiencing stress should be addressed lifestyle issues. In women with gonadotrophin deficiency due to hypothalamic cause, اللي هم group 1 hypothalamic hypogonadotrophic hypogonadism, the most physiological treatment of anovulation is with pulsatile administration of GnRH agonist through a battery operated pump. اللي عندهم مشكلة بالGnRH الهايبوثالاموس مالتهم ما قاعد ينتج GnRH، هذول we should give in a physiological way اللي هو البلسيتايل، والبلسيتايل صعب ياخذه، لهذا اكو جهاز بامب خاص حتى يعطيه بصورة مشابهة للطبيعي. Patient with Sheehan syndrome, treatment is by gonadotropin replacement, together with hormonal replacement of other aspects of the panhypopituitarism, hypothyroidism, and hypoadrenalism. Monitoring is performed by serum estrogen and pelvic ultrasound. Luteal phase support is provided by human chorionic gonadotropin HCG injections. Polycystic ovarian syndrome, weight loss and dietary measures. دول اللي عندهم مشكلة البيتويتري hypopituitarisms, whether pan hypopituitarisms or whether focal hypopituitarisms. دول نعطيهم gonadotropin، نعطيهم FSH و LH. وشون نتابع احنا السكسس مالتهم؟ حنشوف الاستروجين يصعد، حنشوف الاوفيوليشن يصعد. من صار عندهم اوفيوليشن انا لازم اللوتيال فيس هم لازم اسوي له سبورت. السبورت يكون عن طريق اعطاء البيتا اتش سي جي، عن طريق اعطاء الاتش سي جي حتى اقدر اضمن حدوث البريجننسي، واذا صار بريجننسي اقدر اضمن استمراره. بالنسبه للبوليسيستيك اوفاريان سيندروم دول يحتاجوا لهم weight loss especially in those who have increased body weight. Ovulation induction. Clomiphene citrate is an orally active synthetic compound with estrogenic as well as anti-estrogenic properties, which has traditionally been the treatment of choice in a woman with an ovulatory PCOS. It is administered in an initial daily dose of 50 mg on day 2 or 5 of a spontaneous or induced menstrual period for 5 days. The dose can be increased up to 150 mg per day until ovulation is achieved. يعني أنا أقدر أبدي من يوم 2 من السايكل لمدة 5 أيام، أو أبدي من يوم 5 من السايكل لمدة 5 أيام. The side effects include the anti-estrogenic effect of thickening of cervical mucus, in addition to abdominal distension and pain, breast tenderness, hot flushes, and mydriatic effect on the eye causing blurring of vision. The most significant adverse effect is the risk of multiple pregnancy and ovarian hyperstimulation syndrome, which mean enlarged ovaries with huge ovarian cyst, nausea, vomiting, critical ascites, pleural and pericardial effusion, oliguria, renal failures, and venous thromboembolism. This is one of the complication or side effect of the clomiphene. Multiple gestation, as you see. Ovarian hyperstimulation syndrome. This is an MRI for a ovarian hyperstimulation syndrome. This is all of this is an ovary. This is an ovary. These all are cysts in an ovarian hyperstimulation. Gonadotropin. Treatment with gonadotropins is commenced when women either do not respond to clomiphene citrate or fail to conceive after taking these drugs from 6 to 12 cycles. These include recombinant FSH or purified urinary human menopausal gonadotropin, which contains FSH as well as LH. These drugs carry high risk of multiple pregnancies and ovarian hyperstimulation syndrome. Thus, they are used in a small incremental doses until follicular development is initiated. Metformin. The strong association between anovulation and insulin resistance has led to the use of insulin sensitizing agent like metformin. This is an oral biguanide which has been used for the treatment of hyperglycemia in maturity onset diabetes, but does not lower the glucose level in euglycemic subjects. Is associated with nausea, vomiting, and other GIT disturbance, and can cause lactic acidosis in patient with with renal function, those who have deteriorating renal function. Laparoscopic ovarian drilling by diathermy or laser is a further treatment option for women with anovulation associated with PCOS. The principal advantage of ovarian drilling include monofollicular ovulation, resulting in fewer multiple pregnancies, rate and no risk of ovarian hyperstimulation syndrome, but it has risk of general anesthesia and vessels or visceral injury. For punctures are delivered through the ovarian surface to a depth of 4 ملم. الفائدة مالته اكو بعض المرضى ما يقدرون يتابعون، مثلا هي قاعدة بمنطقة بعيدة ما تقدر تجي تتابع على مود الدوز. احنا قلنا الجونادوتروفينز وهاي لازم يراد لها متابعة للفوليكيولر جروث، اكو قسم ما يقدرون، فلهذا يسووا لهم الدريلينج. ورا ايضا ما يكونوا فشلوا بذيك التريتمنت، فالدريلينج ممكن achieving monofollicular واقلل الريسك اوف multiple pregnancy and اقلل الريسك اوف ovarian hyperstimulation syndrome. بالمقابل بي سايد افكت اللي هو انه انا حعرضها جنرال انستيزيا، ممكن يصير عندي انجري، ممكن يصير عندي ادهيجن، فبيها سايد افكت، بيها يعني advantage and disadvantage. This is a laparoscopic view of the ovary. This is هذا شكل الاوفري اللي يكون polycystic ovary، وهاي الدريلينج، هاي النقاط هي الدريلينج اللي نسويها بيها. هذا هنا مالت PCOS فيسوون بيها. هذه هنا هواية، هنا تقريبا 4 5 بس هي بيها طريقة حسابية صراحة، يحسبون على الفوليوم ويحسبون على الفولتي وهاي، بحيث يطلعون ايش قد الكل اوفري ايش قد دريلينج يسوون بيه، بس هو مو اقل من 4 دريلينج نقدر نسوي بيه. Women with premature ovarian failure have egg donation as their only option to achieve conception. The donor should be a maximum of 35 years old, healthy and screened for hepatitis B, C and HIV. Hyperprolactinemia. Prolactin secretion is regulated by the inhibitory control of dopamine. Bromocriptine, which has a dopamine-like action, is effective in hyperprolactinemia and can shrink microadenomas. It is given 2 to 3 times daily, and side effects include nausea, drowsiness, fatigue, and postural hypotension. Cabergoline is a newer dopamine agonist which is used for treatment of hyperprolactinemia. Fewer side effects and longer half-life, allowing it to be given twice weekly, made it preferable for treatment. المشهور عندنا دوستينكس. Cabergoline هو نفس الاسم التجاري دوستينكس. In rare cases, transsphenoidal surgery may be considered in women with pituitary tumors, especially in those intolerant to drug treatment or the pituitary adenoma does not shrink in response to medical therapy. Management of male factor infertility. General lifestyle advice should be offered and where a specific cause is identified. Targeted treatment should be considered. Gonadotrophins, pulsatile GnRH, gonadotrophins, and HCG are used to treat hypogonadotrophic hypogonadism in male, hormonal deficiencies, and produced an acceptable sperm count in 80% of men with azoospermia. Surgical treatment. Examples of surgical procedure include epididymovasostomy for those with post-infective block, reversal of vasectomy, and surgical repair of varicocele. Ejaculatory failure. Medical treatment for an ejaculation or retrograde ejaculation may be effective in some cases. Assisted reproduction techniques. ARTS. When semen parameters are poor or other treatment modalities have failed, it may be appropriate to consider assisted reproduction techniques such as intrauterine insemination أو ما يعرف بالتلقيح الاصطناعي or IVF in vitro fertilization. Obstructive azoospermia in the presence of normal testicular volume and FSH level can be treated by surgical sperm retrieval followed by intracytoplasmic sperm injection. The prognosis for non-obstructive azoospermia with a small atrophied testis and high FSH level is poor. يعني الأوبستراكتيف أحسن مما تكون non-obstructive، لأن على الأقل بالأوبستراكتيف أنا عندي functional testis and I can retrieve the sperms surgically، بينما بالنون obstructive عندي المشكلة بالتستس بالبرودكشن، فمن يجي لهذا عادة الدوس اللي عندهم non obstructive azoospermia failure rate مالتهم يكون عالي even with assisted reproductive technology unless we used a sperm donation. Treatment of a tubal factor infertility. The treatment of a tubal disease aims to restore normal anatomy, but the chance of success depends on the severity and location of the tubal damage, age of the woman, availability of suitable equipment, as well as an experience and the training of the surgeon. يعني أنا حتى أسوي counseling للبيشنت وأقول له أنت حتنجح التيوبال سيرجري مالتك أو لا، لازم أشوف إيش قد المشكلة صايرة بالأوفري بالتيوب عفوا، وين السيفيريتي واللوكيشن مالت البلوكج. اثنين، ايش قد عمر المرأة، يعني هي عمرها نهاية الثلاثينات أربعينات، أنا ما أقعد أحاول وياها بتيوبال سيرجري، جزء العشرينات بها مجال. الافيلابيلتي اوف سوتابل equipment، هذه مايكرو سيرجري لازم تكون موجودة عندي، وأيضا لازم عندي well trained surgeon على هالموضوع. Surgery has been shown to be effective in cases of minor to moderate tubal damage, but of no benefit to women with severe tubal disease. Intrauterine pregnancy rate of about 50% can be seen within 6 months of microsurgical tubal surgery. It has less risk of ovarian hyperstimulation syndrome and multiple pregnancy. However, there is a 5% risk of ectopic pregnancy. Before deciding on a tubal surgery, ovulation should be confirmed and seminal fluid analysis should be normal. يعني أنا قبل ما proceeding for tubal surgery وأعرض المريضة لكل هالمخاطر لازم أكون متأكدة أنا عندي good ovulation ولازم عندي good seminal fluid analysis parameters. If peritubal or periovarian adhesions are present, they can be removed by laparoscopic adhesolysis. When the fimbria are involved, a fimbrioplasty to remove the fimbrial adhesion and repair the fimbrial disease can be successful. In vitro fertilization هو an alternative to surgery and would be recommended if there were extensive damage for the intrafallopian tubal damage or if the surgery failed to restore patency. يعني أنا بدل ما أروح على السيرجري لما أكو سيفير عندي أو لما failed بالسيرجري أنا ممكن ألجأ إلى in vitro fertilization IVF choice. Endometriosis. The presence of endometriosis compromise the chance of spontaneous pregnancy. The prognosis is also related to the severity of the disease. Initial management may involve expectant, no treatment, or medical management. Medical management هنستخدم الpharmacological agent used of the treatment of endometriosis like combined oral contraceptive pills, progesterones, danazol, gestrinone, and GnRH analog. Treatment with this agent has not shown to improve pregnancy rate. Surgical treatment. Laparoscopic surgical treatment of minimal to mild endometriosis increased the pregnancy rate. Anatomical distortion of the pelvic secondary to moderate or severe endometriosis can be corrected by surgery. Endometrioma, ovarian endometriosis, treatment by cystectomy achieves better result than drainage or coagulation. يعني نشيلها للسيست أحسن مما أسوي لها drainage. يعطيني pregnancy rate أحسن. Intrauterine insemination. Controlled ovarian hyperstimulation along with IUI, intrauterine insemination, has been used to treat women with mild endometriosis, where the fallopian tube are patent. In vitro fertilization used for cases with moderate to severe endometriosis and in those who failed to respond to above measures. Endometrioma may need to be removed before IVF trial to ensure higher pregnancy rate and avoid accidental puncture during oocyte retrieval. Unexplained infertility. In the absence of a specific diagnosis, any form of a treatment is speculative. Treatment could be conservatives, medical using clomiphene citrate, by arts, which include IUI with or without superovulation by gonadotropin injection and IVF. يعني هاي التريتمنت ممكن تكون conservative، ممكن نستخدم كلوميفين، ممكن نستخدم IUI، ممكن نستخدم super ovulation by gonadotrophin injection، وممكن نستخدم IVF بكيسات unexplained infertility. While planning treatment, the likelihood of spontaneous pregnancy must be taken in account. يعني خلال احنا ما قاعد نحضر ونعطي أدوية ممكن يصير spontaneous pregnancy. The decision to initiate treatment also depends on the woman age. لازم نخلي الwoman age in our consideration. يعني اللي صار لها 4 سنين متزوجة وهي متزوجة من عمرها 15 سنة ما استعجل عليها مثل اللي متزوجة وعمرها 36 سنة وصار لها سنة لو سنتين متزوجة. فإذا الwoman age جدا مهم بهذا الموضوع. Assisted reproduction, assisted conception technique have since their introduction in the late of 17th enable more than 1 million babies to be conceived. All the techniques really rely on the basic concepts of placing the egg and the sperm in close proximity to facilitate fertilization. Today, the commonly used technique of intrauterine insemination (IUI), in vitro fertilization (IVF), and intracytoplasmic sperm injection (ICSI) are widely used throughout the world to assist conception. Intrauterine insemination involves the placement of a purified sperm sample in the uterus at the time of ovulation. It is most successful if combined with ovarian stimulation to produce up to 3 mature follicles. Close monitoring of treatment is essential to avoid the risk of multiple pregnancies. It is used mainly, not exclusively, used to treat mild male factor infertility and unexplained infertility. In vitro fertility. This is the picture of Lewis Brown, which is the first test tube baby. In 1977, Steptoe and Edwards successfully carried out a pioneering conception, which resulted in the birth of the world's first baby to be conceived by IVF, Lewis Brown, on 25th of July 1978, in Oldham General Hospital, Greater Manchester in UK. This is her picture at time of delivery, and this is when she is growing and she, also a baby. This is a Lewis Brown, the first test tube baby. In vitro fertilization, a typical IVF embryo transfers called ET cycles include. اللي أطلبه من عندكم هنا إنه بس تعرفوا لي المقدمة، يعني تنحفظ بس العنوان، الشرح حتى تفتهموا، يعني حتى يكون عندكم فكرة عن الاي في اف. انتم طلاب طب صف خامس، المفروض تكون عندكم فكرة عن هالموضوع، ما مطلوب تحفظون كله، بس الستيبس الهيدلاين مالتها نعم مطلوبة، لكن الباقي لا، هاي حتى تفتهموها. First, initial consultation. This is include a detailed history and provides an opportunity to assessing the cause of infertility and the most appropriate treatment technique. Prior to commencing IVF, a recent baseline FSH, seminal fluid analysis, pelvic ultrasound are assessed. Counseling and screening for infection are provided. And then first of all, cancellation. Pituitary downregulation. This is essential to prevent the natural LH surge. لازم أني أوقف البيتويتري عن العمل حتى ما أخلي الناتشورال LH يطلع، أني أبطي. فإذا نسميها pituitary downregulation to prevent the natural LH surge and follicular rupture prior to egg retrieval, and this is done by GnRH agonist or antagonist injection. أما agonist or antagonist. 3. Ovarian stimulation. This is achieved by daily gonadotrophin injection for up to 2 weeks until the largest follicle are 18 mm in diameter by transvaginal ultrasound. سويت down regulation، أبدي أعطي gonadotrophin، أكبر الإيجز لما أكبر وحدة توصل 18 عن طريق الترانسفاجينال ultrasound. Ovulation trigger by HCG injection. The oocytes are retrieved after 34 to 38 hours after injection. هنا نكون دقيقين بالمواعيد، نضربها للأوبرا نحسب لها 35 ساعة تقريبا ونسوي لها retrieval. Oocyte collection, this is done under transvaginal ultrasound guiding with the woman under IVF sedation يعني under anesthesia وعن طريق الترانس vaginal ultrasound احنا حنسوي oocyte collection. During sperm preparation, the sperm sample is washed to remove the seminal plasma leukocyte and bacteria. خلال ما أنا قاعدة أسوي retrieval للأوسايت وأسحبها، بهذا الوقت يكونوا محضرين السبيرمز ومسوي لها wash ومسوي removal للseminal plasma leukocyte and bacteria. Inseminization. The prepared sperm sample is mixed ويا الأوسايت. هذا conventional IVF. يجيبون دش هم يسموه تيست تيوب بس هي صراحة بدش صارت مو بتست تيوب بالدش يحطون اوسايت ميكست الاوسايت اللي سحبناها من البودي مالت المذر من الاوفري مالت الومن نحطها بهذا 4 إلى 6 ساعات ونحط وياها ايضا السبيرمز incubation for ونسوي لهم incubation 16 to 18 hours. Next is fertilization and embryo cleavage. The embryo are assessed for its quality and prepared for transfers. بعدها نسوي يشوفوها تقريبا ورا يومين 3 أيام ايش قد صارت عندهم امبريوات نوعيتها اكو تايب 1 تايب 2 تايب 3 هاي كلها يعرفوها الامبريولوجيست حيسوون الامبريو ترانسفيرز الاي تي. The embryo are transferred to the uterine using a transcervical catheter. كاثيتر يدخل بالسيرفكس وندفعه اما second او third day وبعض الاحيان الفifth day second او third day من الكلتشر او بعض الاحيان الفifth day. 2-4 embryo are transferred per trial. هاي بروتوكولات حاليا يميلون انه ما ينقلون كميات كبيره لان احنا حندخل معمعه المالتيبل بريجننسي ومشاكله فاب تو 2 to 3 ينقلون في كل مره وهذه هم ايضا بروتوكول يختلف من مركز الى مركز. Luteal support and establishment of a pregnancy. This is provided by progesterone supplement in the form of vaginal pessaries, suppositories, or injection. Pregnancy is detected by urinary pregnancy test or analysis of serum beta HCG 14 days after embryo transfer. Complication for the IVF cycle could be ovarian hyperstimulation syndrome, could be an ectopic pregnancy. 4% of the pregnancies arising for IVF treatment will be ectopic, with an increased risk in women with a tubal damage. Multiple pregnancies have both increased morbidity and mortality for both mother and babies. This is reduced by limiting the number of embryo transfer, and if it occurs later on, it can be managed by multi-fetal pregnancy reduction. Intracytoplasmic sperm injection (ICSI) is where individual morphologically normal sperm are mobilized and injected into a mature oocyte. It is used for severe male factor infertility. بهالحالة ياخذون سبيرم وحدة morphologically يعني genetically أنا ما أعرف بيها بس بالشكل مبين شكلها زين تحت الميكروسكوب يسحبون سبيرم وحدة ويدخلوها إلى السيتوبلازم مالت الأوسايت. هو هذا الإكسي الحقن المجهري. Egg donation and donor insemination. Gamete donation is used. Gamete donation used in couples where conception is impossible to achieve conception using the individual's own gametes. Peri-implantation genetic diagnosis (PGD) for couples at risk of child with an inherited disease. PGD offers the opportunity to select unaffected embryos for transfers. هاي يعني تعريفات مهمة يعني المفروض نعرفها احنا كطلاب طب وإن كنا مو اختصاص بس هذه you should know it. تنسأل عليها لازم يكون عندك عليها معلومات. and thank you. المحاضرة يمكن شوية طويلة بس هي عبارة ترى عن محاضرتين يعني احنا الانفرتيليتي عندنا محاضرتين first and second فاني هاي سويتها كلها تسجيل واحد. اي سؤال يا ريت تكتبوه بالكلاس وانا ان شاء الله حاضر اجاوبكم عليه. شكرا.